Imagine waking up one morning and realizing your hand is no longer yours. It buttons your shirt when you don't want it to. It reaches out for objects you never intended to touch. It rises into the air as if pulled by invisible strings. What would you do if your own body betrayed you? This is not science fiction. This is not a horror story. This is a real medical case, and it happened to a 62-year-old man whose life changed in the blink of an eye. Doctors would later call it alien hand syndrome, one of the strangest and rarest neurological disorders ever documented. But in this case, there was something even more unusual, a hidden stroke in his brain that gave birth to an alien within his own body. Stay with me, because this story will challenge everything you thought you knew about the human brain. It began like any ordinary day. A man in his early 60s, with no warning signs, suddenly felt his right hand moving on its own. At first, he thought it was just a twitch. After all, we all get muscle spasms sometimes, right? But this was different. The movements were deliberate, purposeful. His hand began buttoning his shirt without his consent, reaching out to objects as though guided by someone else. Even scarier, he could feel the movements, but he couldn't stop them. He described it later. My arm raised involuntarily above my head like a marionette. My hand refused to listen to me. It was as if it had a mind of its own. Think about that for a second. You look at your own hand, but it no longer obeys you. Would you feel fear, confusion, or would you wonder if you were losing your mind? At first, his family thought it might be stress, or maybe even a seizure. But within just 30 minutes, things got worse. The strange hand movements faded, replaced by something even more terrifying. His right side grew weak. His speech became slurred. Soon he could no longer move his right arm or leg. He couldn't even form proper sentences. His face drooped. This was no longer just a strange hand problem. This was a life-threatening stroke in progress. When he arrived at the emergency unit, doctors immediately noticed the classic signs: aphasia, hemiplegia, and sensory loss. His blood pressure was dangerously high at 170 over 100 millimeters of mercury. The situation was critical, but what baffled them most was the alien hand phenomenon. It wasn't just a stroke. It was a stroke with a rare and disturbing twist. Time is everything in stroke medicine. Every minute, millions of brain cells die. The first step was an urgent CT scan to rule out bleeding. Luckily, there was no hemorrhage. That meant one option was on the table: intravenous thrombolysis, which is a clot-busting treatment designed to dissolve the blockage in his brain. Doctors administered recombinant tissue plasminogen activator, RTPA. For a stroke of this scale, it was the only hope. Imagine the tension in that hospital room. Would the clot dissolve in time? Would his brain recover? Or would he be left permanently disabled? Maybe even locked inside his own body? Over the next 24 hours, signs of improvement began to appear. His speech slowly returned. His right side regained some movement. The alien hand movements disappeared. But what exactly had happened inside his brain? An MRI provided the answer. It revealed an acute infarction in the left parietal cortex, particularly in the postcentral gyrus, the brain's sensory hub. This small patch of brain tissue, when cut off from blood supply, had created one of the rarest neurological disorders on Earth, alien hand syndrome. But what is alien hand syndrome, really? First described in 1908, it's a condition where one limb, usually a hand, moves involuntarily, yet with goal-directed action. The movements aren't random spasms, they look intentional. Patients often say the limb feels foreign. Some describe it as possessed. Others say it acts with its own will. There are different types. The frontal variant, where the hand compulsively grasps objects. The callosal variant, where the hands seem to fight each other, and the posterior variant, where the hand rises into the air or moves aimlessly, often with a disturbing feeling of foreignness. Our patient had the posterior type. But here's the twist. Alien hand syndrome usually affects the left hand after a right-sided brain lesion. In this case, it was the right hand, linked to a left-sided stroke. Only a handful of such cases have ever been reported worldwide. For patients, alien hand syndrome is more than a diagnosis. It's a nightmare. Imagine your left hand unbuttoning your shirt while your right hand tries to button it. Imagine trying to hold a cup, only for your other hand to push it away. Imagine being slapped by your own arm. Some patients even cover or restrain the alien hand, fearing what it might do. One woman reportedly tried to tie her alien hand down at night, afraid it would harm her in her sleep. Fortunately, in this case, the alien hand phenomenon resolved after treatment. But not everyone is that lucky. Some live with the condition for years. Thanks to quick intervention, our patient's outcome was far better than expected. His aphasia resolved, his strength improved, and the alien movements stopped. But not everything returned to normal. He was left with persistent right-sided sensory loss, a permanent scar of his stroke. He now relies on medications, lifestyle changes, and regular follow-ups to prevent another attack. Doctors later concluded that his case was one of the few documented examples of right-sided alien hand syndrome caused by a left parietal stroke. Rare, unusual, and medically fascinating. This case leaves us with profound lessons. The brain is a fragile map. A small clot in the wrong place can change identity, control, even the sense of self. Alien hand syndrome is real. It's not fantasy. It's neurology. Without immediate thrombolysis, this man's outcome could have been devastating. And maybe the biggest lesson? We are never as fully in control of our bodies as we like to think. The story of this 62-year-old man isn't just about a stroke. It's about what happens when the brain rewrites reality, when your own hand becomes a stranger. For a brief, terrifying moment, he lived with a limb that disobeyed him, a hand that no longer felt like his own. And while medicine saved his life, the memory of that betrayal will stay with him forever. So I leave you with this haunting question. If a part of your body suddenly turned against you, would you still trust yourself? Let us know in the comments, and like this video, subscribe to our channel for more interesting medical real case studies.